Hey guys, hey! I just wanted to come on here tonight and talk to you guys about some of the things that I've been researching. And I wanted to clear up some things that people talk about it, but they don't clear it up. They don't say why it's happening. So I just want to come on and talk about the anesthesia, what's the side effects from it. Also, I want to talk about the different types of anesthesia and why people are saying that they're waking up in the recovery room shaking uncontrollably. They're so cold and all that. They got a sore throat. So I just wanted to come on and try to clear up some of that. So I want to start off by saying I'm not a doctor. I'm not a nurse. I'm just sharing what I've gotten through doing my research, what I've learned. Okay. First of all, let's define anesthesia. Anesthesia is a controlled state of unconsciousness. You shouldn't feel any sensation. You shouldn't feel any pain or anything like that. But there are 4 types of anesthesia, guys. You have general anesthesia, which is the anesthesia that the plastic surgeons love to use. You got your moderate anesthesia, which is just a sedation. Say, for instance, you're going to get a tooth extracted or whatever, and they sedate you to get the tooth out. Then you have the local anesthesia. Most dermatologists use the local, like when they want to get a mole off or whatever, they just it's how they say inject that area to make it numb or whatever, and take the mole off. And then you got regional anesthesia. Now, regional is when you want to numb one certain part of the body and work on it. That's regional. So for plastic surgeons, they normally use the general anesthesia. Okay, are we good? All right. So when you get ready to go under anesthesia, you fill out all this paperwork and all this stuff, and then once you've cleared, they take you in and they attach these monitors to you. And what those monitors are doing, they're measuring your heart rate, they're measuring your blood pressure, and they're also measuring your oxygen level. Okay. Now, once you've done that, they put these little things on your finger and all that. Once you've done that and you're asleep, after you go to sleep, they take this breathing, it's called what do you call it? A trach tube. They take that tube and put it down your throat. But this is after you're asleep. So they do your chin up, open your mouth, and put it down your throat. So that's how they regulate your breathing while you're doing the surgery. Now, while you're under, they also give you fluids, antibiotics, painkillers. They give you all that while you're asleep. So when you wake up in recovery, you feel okay. You're not in a whole lot of pain, but they do that so that you're comfortable when you go into recovery. The nurse, you have a nurse in the recovery room. The nurse is going to come in and they're going to make sure that you're comfortable. They're going to ask you different questions. Do you feel nauseated? Do you feel like you want to vomit? They ask you all these questions and they're checking your heart rate, your blood pressure, and your oxygen level again. Most people don't realize that once you go into the ER, guys, the ER room, if everybody don't know the OR, which means the operating room. When you go in there, that temperature is so cold. It's real low. And I did my research on it, and a lot of the reason why that is so low is because of sanitation. They want everything to be sanitated. Y'all, just remember, you are, how do I say it? You're on this table for 4 hours or longer, butt ass naked. This temperature is low as crap. But because you're under the anesthesia, your brain you're not gonna get that signal to your brain to say, oh my God, I'm cold. So you're not shivering and doing all that during surgery because that signal hasn't been sent to your brain. Okay, because you're unconscious. Now, once you get out of surgery and you go to your recovery room, guess what? You're not unconscious anymore. Once you wake up, you're not unconscious anymore. So now, guess what is going to happen? It's going to send that signal to your brain, and guess what's going to happen? You're going to start shivering uncontrollably. This is what's happening. The temperature of your body is what your brain is reading. So your body's going to react to what the signal that your brain's getting. So you are gonna shiver, and you're gonna shiver so uncontrollably because you've been in an operating room, butt naked for hours, and you're cold. Your body is cold, so it's responding to that. Now you've been exposed all this time, and now you're in the recovery room. They give you blankets, they give you whatever, and you're still cold. Y'all, that shivering is not gonna stop until your brain get that signal that okay, I'm better now. I'm normal. Then you can stop. It's your old shivers and cold will start to come down, but it's only after your brain has received that signal that hey, I feel better now. I'm good. So I don't care how many blankets you put on you in that recovery room. I don't care how warm they are. Your body is not going to receive that signal until it's down to a level where your brain gets it. Okay? Sore throat. The reason why you have a sore throat, because as I said, they take a trach tube and put it down your throat. Now, mind you, and you have, I'm sorry, if you have your mouth open for hours, y'all, there's no saliva, nothing going down there. It's going to be dry. So where that tube is, y'all, where that tube is, that's going to be sore because when they take it out, oh, y'all had to swallow when I said that. When they take it out, that's where the soreness is going to come from. So, and it don't last long. You know, you can do some throat lozenges or whatever, and then you're going to be fine. But yeah, you will experience that soreness in the throat. And yeah, you're going to experience the shivering and the cold because that's one of the side effects from the anesthesia. Y'all, mm, mm, mm. Once the nurse comes in, after you've been into recovery, whatever they're going to give, once you go into your room, they're going to give you something to eat and they're going to give you something to drink. Y'all, if you got to wait 8 hours before your surgery without eating anything, then you go through your surgery for 4 hours or more. Then you go to recovery for however many hours. Y'all, by the time you get to that room, you should be starving. I know I'm going to be starving, so I want whatever they give me. I'm taking it because I'm greedy as hell. But I can't wait to wake up in recovery and be shivering because I know my fat ass is alive. So, let's go back to when I said that the anesthesiologist will put something on your fingers so they can monitor your heart rate, your blood pressure, and your oxygen saturation. In order for them to be able to do that, in order to get a good reading, you got to have at least one finger. I ain't going to use that one finger that they can put the little thing on, and they got to be able to see the nail bed. They got to see whether or not it's turning blue or whatever the case may be. They can't see that if you have a nail over your nail bed or if you have it polished. So that's why a lot of doctors ask you to don't wear nails, don't wear polish or whatever. That's the reason why. Now, y'all, in order for them to get that trach tube in there, they got to do this, and your head has to be flat so they can put it down correctly. Now, if you go to your surgery, and y'all don't take this personal, but if you know you're going to have surgery, y'all, don't go and get 1,700 braids in your hair down to the crack of your ass. When you ball, you got to be able to ball that up and put it in a bun on top of your head, or be able to get it to where it's flat enough to go into that hospital cap. But you cannot lay there with a hump in the back of your head. You got to be able to lay flat so they can get that tube down in there. So guys, when you get ready to go do surgery, think about your hairdo. Think about how that's going to affect your surgery. A lot of people don't think about it. If you got to have the braids, find out some kind of way to split it to the side and put the things up this way or whatever you got to do. Make sure this is flat. This has to be flat in order for that tube to go down correctly and you be able to breathe during your surgery. Okay? So don't go get no brand new nails because you're going to be disappointed because they're going to make you take them off. And y'all, just have enough hair to y'all, I love my wigs and I love my wig too. But I'm not finna wear no hair that's gonna keep me from getting that tube down my throat like I supposed to. So when they ask you to do that, they asking for a reason, guys, and it's all for your safety. Okay. So I just want to come on and tell you guys that. Oh, I forgot, y'all. Do y'all? Now I know y'all love y'all lashes, and I don't have mine on right now because when I got home, y'all, my face was itching so bad, and I don't play with my skin. I wiped my face, took them lashes off, and took all that shit off. But here's the thing: when the anesthesiologist is doing everything that they need to do, they're gonna tape your eyelids down. And I was curious about why they do that, and they stated that they don't want you to have any damage done to your cornea, just in case you open your eyes, you know about that anesthesia awareness when you wake up. So they tape your eyelids down, y'all. Now, if you got them lashes on, if you got them lashes on and they tape them down, now y'all, when they get ready to take that tape off, I don't know how many lashes you're gonna have, and I don't know if both of them gonna come off, or if you got the individuals, they ain't gonna be no good look. So just don't get your fresh lashes and your fresh nails and all that stuff to go do surgery. You're going to do surgery. Just get prepared for surgery. Okay? And just follow the doctor's instructions. That's all I'm saying. So make sure you don't have your lashes on, your nails. Make sure your hair can go up in a bun to where your head can lay flat. Don't eat anything 8 hours before your surgery. You cannot drive for 24 hours after being under anesthesia. So guys, be mindful of what you're doing. Be mindful that this is a surgery. This is not, you're not finna get ready to go out to the club and none of that. Just be comfortable and make sure that you're safe while you're doing this comprehensive surgery. Okay. So I just wanted to come on and say that, and I wanted to say I love you guys, and I hope I helped somebody. I'm so ready to go, y'all. I'm tired too. But y'all, just take that to heart. And I hope that somebody learned something from this, and I hope that somebody got a question answered that they wanted answered. Yes, you are going to be shivering uncontrollably until your body sends that signal to calm down. Yes, you are going to have a sore throat because of the trach tube that's down your throat. And just be mindful that you got to work with the doctors, guys. So again, no nails, no whole lot of hair, and don't wear your lashes. You'll be fine. All right, love you guys. I'll talk to you later.